Hi, my name is Marissa Staten with RevitalyzeMD. I'm here to talk about our fabulous Fotona Neck Tightening Treatment. We have a live video that we are going to show you. But before we start, please like and subscribe so we can provide you more content in the future. Here we go. So here I am just cleansing the patient with a ZO Skin Health product called Gentle Cleanser. It's a gel-based cleanser that is perfect for right before treatments. I'm just rinsing the product. Next, I'm going to use 70% alcohol just as a degreaser to prep the skin right before we actually put numbing cream on. The numbing cream is going to make the patient a little bit more comfortable as we go. This step is done with a 1064 nanometer wavelength. It's going very deep into the dermis. It's actually tightening the skin at a deeper level than most lasers. And after this step, this is a very quick step. As you can see right here, I am going over the jowls, and I'm not going to go over the thyroid cartilage area, as you can see that, but I'm going to do a very quick focus in the spots that matter, such as the jowls, the submental area right underneath the chin. I like to make sure I hit right under the ear. As you can see right there, that just makes such a difference with tightening the jowl area, because that is an area it is meant to be a little loose for movement in our mouth, for eating and talking, but at the same time, that is the area we lose elastin the fastest. So I definitely want to make sure that I focus on that area. This is doing deep tissue heating as well, but at not quite the same level as the first step. What they do together is called bulk heating. With bulk heating, you're getting a thermal relaxation, a photobiomodulation, and basically what that's going to do is at a deeper level and multiple levels, it is going to tighten that skin. So the next step after this is going to tighten superficially. But anyway, I spend a little bit more time with this particular step. Photobiomodulation basically is where you're creating a micro injury in the dermis, and your body will send stem cells to the area. When that happens, your skin starts to build collagen and elastin, and that actually helps tighten the skin and also thicken the skin, which is what we want, especially around our neck area. And notice right here, I am holding on or lifting the distance gauge, so I'm not pressing on the thyroid cartilage here. It's a very delicate area, so you can see that I'm doing that right there. And I also told the patient there to let me know if she did feel pressure. It's something I try to make sure I'm very cautious of. This part's very comfortable. It actually, for most patients, is very relaxing, this particular step. The next step is the one we actually have the numbing cream for. But look right there, I am trying to chisel her jowls, if you will, right there at the jawline. That is definitely the focus. And the laser itself, you see that I'm not moving. The laser the handpiece is actually a scanner. So it is scanning the area over and over again. And also counting the pulses that we're there. I also have a thermometer that is telling me the temperature, a temperature gauge that is telling me the temperature of the skin, so I know when to stop or move on to a different area, because we want to get to a certain temperature and then move on. Notice I'm focusing also on the submental area. This area, we can also kill fat if we, by a longer time. If we stay in this area for longer, we could actually kill fat in this area. So that's the reason you want to pay close attention to how long you're staying in the area. But if someone did have extra fat in that area or adipose tissue, we could focus on that. And with this, after this step, you can see an immediate difference. You can do these steps individually, but together they are amazing and you get much faster results. So now we're taking off the numbing cream. Taking off the numbing cream is important for the next step, because we want full penetration, because the next laser is going to be a 2940 nanometer. It is more superficial. It doesn't penetrate as deep as the other two lasers, but it creates more of a superficial tightening, which is, I like to refer to it as shrink wrapping. This right here, you'll notice a tap that I'm doing. I do that for the patient comfort. It's just a little tap. And even though we did use numbing cream, all of your nerve endings are at a superficial level, so you still feel this a little bit. So I always want to make sure that the patient is comfortable, because I don't want them jumping around in any kind of treatment. You know, safety first. Usually if I stop the tap, the patient asks me to continue, because it takes their mind off. It's a nice distraction. This laser I can also use over the thyroid cartilage. It does not penetrate deep enough to interfere with the thyroid. And of course, we want to make sure we focus very hard on the submental area right here under the chin. And I like to get that the skin right underneath the ear really, really well. Again, I mentioned earlier that the skin under our jowls and closer to our ears is meant to be a little loose, so we have movement for our mouth, to eat, to talk, but it's also the first place we lose collagen elastin and starts to sag. So I really make sure I focus on that area. Notice right here, I'm also picking up the distance gauge or the spacer. That was it, guys. Thanks for watching. That was our fabulous Fotona Neck Tightening Treatment. You have watched it all. If you have any questions, please put them in the comments below. Don't forget to like and subscribe so we can give you more content in the future. Again, my name is Marissa State with RevitalyzeMD, where we're here to revitalize your look, your health, and your sex life.